This is Bishop Dr. Truman Burst. Master Herbalist, coming to you from Good Shepherd Ministries.
You can go ahead and what would you where do we need to start here again? I know we've talked about the planters.
We went through all my issues except for the fibromyalgia and the borderline diabetes.
Okay, so we need to really get into this borderline diabetes thing and talk about that. Is that what we should do?
Yeah, and the fibromyalgia.
Okay, all right. So our topic tonight then is going to be diabetes, and we'll see how far we can get through diabetes, and then we're going to talk about fibromyalgia. So, all right, let me get up here on the computer and get my information in front of me and take a sip of tea. And something. Oh, I got this. It's got to go there. That's that one. And here's this one. Whew, found the right one. Okay, now I'm going to here, and I'm going to go to the newsletter, because the newsletter. Let's take a look.
Well, guess what I found out when I went to the doctor last week?
Yes. There in the past issues of the newsletters gives us
Dr. Sherman?
yes.
I found out when I went to the doctor last week that they said I had a hair loss.
Hair loss.
Hearing loss.
Hearing loss.
Yeah.
Ah, okay. Let's, before we jump into this, I'll bring this report up all about diabetes and put this right here, and then I'm going to go over here and I'm going to log out, and now I'm going to go to hearing. I'm going to go into the condition database at healthherbs.com. healthherbs.com, 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 and I'm over here under H. I've clicked on conditions. Now I'm over here under H for hearing, and it's H-E, headache. Oh, you know what? It's under ears. That's why I'm looking under H, and I should be looking under E. I should know this. I wrote this database. Okay, so I missed this. Now I gotta go back. Okay, get me back there, and here it is under.
Would it be under ear?
Yep, that's what it is. Here's under ears and ear infections and so forth. and there's something and
that before, because I had ear, well, I still must have it because my ear still is giving me problem. My left ear, and that's the same ear that they're saying I have the hearing loss.
Yes. Now we've got to watch when we do these things if there's any problems like fluid buildup in the ears or something like that. We need to discontinue, and we need to continue to get maybe a diagnosis from an ear specialist so that he can make sure.
Yeah, that's why I went to an ENT.
Yes. Okay. So, but here's what we do. As long as everything's going fine, here is the natural remedy under ear infections. The first thing on the top is number 6231 Truman's Ear Oil. And you just take this little bottle of oil, and here's the ingredients, so you know what's in there. What's in there is olive oil, mullein oil, garlic oil, and lobelia oil. And those three oils are together, and you put this under the tap and you warm it up so the nice warm oil goes in your ears. And you're going to use maybe 1 to 4 drops in each ear, and you're going to do it 1 to 3 times per day. We'll start with 1 and see how you feel and how you do. We just do it once a day, and then the next day we'll do it twice a day, and then the next day we'll do it 3 times a day. And what this is going to do, this is going to get rid of any inflammation, and the garlic is a natural antibiotic, so it's going to be healing. Excuse me, need to drink some more liquids here.
Doctor, can you tell me, do you know of any negative side effects for antibiotics?
Nothing but negative. The antibiotics are dangerous, and
well, that's what they gave me that too last week, because they said I had a sinus infection.
Well, that's where that antiseptic sinus snuff will get rid of a sinus infection. But the antibiotics, the bad news is the antibiotics just kill off all the friendly bacteria. We have to make sure that after you've been on those antibiotics, and the other bad news is the next time you get an infection or a sinus infection or need that antibiotic, it'll either not work or it will just make everything stronger and worse. It'll get rid of it for a little bit and then it'll come back worse. Because that's what antibiotics do, and that's the problem with them.
I think that's what happened to me before, because 2 months in July I had an ear infection, and I took antibiotics for it then. And then right after I took antibiotics, and it was supposed to be gone away, they said I had it again, and I had to take antibiotics again like 2 weeks later.
Yeah, see, that's just running you in a circle on this thing. And the bad news is again the antibiotics stop working, and then they say, "I'm sorry, there's nothing we can do. Maybe we'll give you some prednisone." That's like dropping the atom bomb on you, and that kills everything, and it will kill you too eventually, and they know it. So what we're talking about here is breaking the cycle. Number 1, you've got to take acidophilus and build up your immune system. So an acidophilus powder would be a very good idea for you to make sure you're getting acidophilus. Like about a half of. The acidophilus restores your friendly bacteria, because that's what's happened. Yeah. You have friendly bacteria and you have unfriendly bacteria. Well, you got to have a balance. And then the body works just fine. But sometimes when things are real bad,
is that number 8902 or
the acidophilus, I think it's in let me take a look here. I think that's number 8413 is what I remember, if I'm remembering right. Let's take a look here and see if I can find the amino acids kits. Okay. Acidophilus, yeah, that's number 8413. You can get it as capsules, or you can get it as a powder. I like the. You can do it either way.
Okay, I already had that on my list.
Good, because you need to take that. Did you get the capsules or the powder?
Okay.
Did you get which one? Which one did you get, the capsules or did you get the powder?
I don't know. I just put down that I wanted 2, but
okay.
I didn't identify which one. I think I was supposed to get the capsules. I think we talked about the capsules.
Okay, that's all right. That's fine. That'll be easy for you to take. So, okay, so
what's the difference between the capsules and the powder?
it might be a little bit less expensive. The next time, or when you talk to Brittany tomorrow, ask her what the price is for the, for the powder, because you get the powder like in about, what is it, about 4 ounces of powder. Let's take a look at it here. Okay, I'm going to bring it up on the screen. 4 ounces of powder, or you can get a whole pound of powder if you're going to use it for long term. Maybe you're really having a bacterial imbalance and you need to keep some around. I take acidophilus every morning, whether I need it or not, because it just keeps the friendly bacteria strong, so you don't come down with something. Doesn't let the unfriendly bacteria get. And they find that that's one of the things that people that are in the know, that's what they do. They take it every day, and it just keeps their friendly bacteria stronger, and the bad bacteria can't get a hold. So let me go over here and take a look. I'm going to bring this up on the screen. 84.13, 80. Let's take a look at the price on that. Okay, so we can determine the best. Okay, what the best deal is. All right, the capsules, 100 capsules. I think they're 500 milligrams each. That gives you 1,000 milligrams, or gives you and the powder. So the powder, I'm trying to figure out how much is in an ounce, because it's 3 ounces of powder for $19.98, or 16 ounces of powder for $93.40. So 3 ounces of powder. I would have to ask them how many ounces of powder it takes to make 100 capsules. Seems to me that it's probably, you get more if you're taking the 3 ounces of powder. You get more than you would get in 100 capsules. But that's a good question when you talk to Brittany tomorrow. Ask her, which one is the most economical. Okay? Because I take the powder. I think it's probably less money.
The powder, does that take effect quicker or something? Is that just...
No, not necessarily. It just, because it's micro-encapsulated. Each grain of the powder is micro-encapsulated so that the digestive juices don't hurt it or get rid of that bacteria before it reaches the colon and the lower digestive tract. So so it's very important that that you take either one and just chase it with some water and get it through the system, and because that powder is made to survive the digestive tract. So that's important, and and it has no taste. So what I do is I just put about half a teaspoonful in my mouth and chase it with some of that Kangen water, and I do that every day. But before I do that, I increase my immune system by taking 2 colostrum capsules, because that increases your immune system, which I believe that is something that you could use, because you've gone through so much that's why you're coming down with sinus infections and ear infections and on and on and on, is because they've got you run down so far with so many drugs, and you've got so many things you're dealing with there, that your immune system needs help. Well, colostrum is a good immune system booster, so I would say a couple of capsules of colostrum in the morning. That's the first thing I take. Then the second thing I take is the acidophilus powder, and chase it down with some water. Of course, that is, and I'm taking that after I'm taking my Intramax. So I'm taking my Intramax liquid, about a half a capful in the mouth, holding it there, taking some humic acid. See, humic acid is the shale from forests that are ancient and have been covered over, and so now, thousands of years later, they've uncovered this humic acid, and And humic acid is an incredible healer. It stimulates the health of plants and animals when they consume it. It also gets rid of radiation, so it absorbs radiation. It is very, very powerful nutrient.
What number is that one?
You know, I don't think it's even. Let me see if it is. Let me see if the humic acid is listed here. No, you're going to have to ask them for it because it's not listed here. You know, there's some of these things that are rather touchy, and so you know, if we're afraid even to put them up on our website, so because you know the authorities would take them down or something, and close our website. So fulvic acid, humic acid is one of those things they don't want you to know about yet.
What's it called? How do you spell it?
HUMIC, humic acid, or it's also called and it's also called fulvic acid. Fulvic. Let's see if it's listed that way.
FOLIC.
Fulvic is FULVIC. Oh, whoops, FUL. I didn't spell it right here. There we go. Okay, full. I got this thing now. Fulvic. Nope, I don't. Now I do. Let's see. I don't think it's going to come up anyway. It's going to give me the same page.
So this is one of those I got to ask her for?
Yeah, you're going to have to ask them for that. So what I do is I have a quart bottle of this liquid. Let's go up in the internet, and because this is something that nobody knows about yet. Guess what? In that Intramax, which is the greatest liquid vitamin, it's got a little bit of fulvic acid in there. But you know, so I go and I get another teaspoonful from my quart bottle of fulvic acid or humic acid, and just a second while I'm gonna go here and grab this here, humic acid, and we're gonna for human consumption. And what does it say here? Okay, where does it come from? Okay, suppliers, culture, humic acid. Okay, I'm trying to find something that's going to give us. Here we go. Scientific information about it. Let's see if this should do it. Okay, so you want natural humic acid, and the benefits of using humic acid daily are, this is research scientist on humic acid for human consumption, Peter Dudek, interviewed by Dr. Richard Laub on 14th of October 2005, and it's humic, let's see, it does not sound. However, since give me some information about it here. Okay.
Were you talking to me, doctor?
Okay, no, I'm sorry, I'm talking to myself. Or talking to the computer screen. It's not giving me the information I'm asking it to give me the information like it would, but it's not. So I'm gonna get away from there because it's just an interview, and I don't want an interview. I want information. So I'm going to go here one more time. But anyway, if you give humic acid to a plant or to an animal, they just it helps their skin, their hair, every part of their body. It is something that is just really impacts your health by increasing your health. Now, and it's got zeolite, so it's getting rid of all kinds of here we go, humic acid. This is what I'm looking for. Sometimes these things are easy to find. Sometimes you have to work a little harder, but we're almost there. Humic acid is a chemical produced by decaying plants, and people use it to make medicine. And people take humic acid for stimulating the immune system and treating the flu, influenza, avian flu, swine flu, and other viral infections. They use humic acid, and it helps to keep the body strong. So what else here? How does it work? There isn't enough information available to know how humic acid works. All they know is that it's stimulating the immune system, and that's something you could use to stimulate your immune system and to fight off any kind of viruses, because at this stage of the game you have gone through so much, you have so many health challenges. You could use anything to fight off any kind of the last thing you want is to catch the flu, right?
Right.
Yeah, so this is going to keep the flu away, but it's also one that is going to absorb radiation. That's one of the things it does, and absorbs things you don't want in your system.
I don't usually get the flu, but I do get sinus infection at least once or twice a year.
Mm-hmm. Well, all of this, this is because your immune system is so low. So I got this information off of WebMD, but I'm still not. I found some better information on it earlier, but I'm not running into it at this moment. So, unless somebody's going to tell me something about it here, then we're going to move on to, here it is. This is what I've been looking for. Okay, so fulvic. The fulvic ionic minerals and fulvic acid are concentrated liquid minerals and electrolytes and essential amino acids in a supplement, and it is the cornerstone of good nutrition. And let's see what else we can say about it. It tells a little bit more about it, but then not enough. Not enough. Let's see if that'll give us more information. I don't think so. So, I think you got the idea of why fulvic acid, right? Okay, hold on just a minute. Hold on. Yes, hello.
Hey, what's going on?
I'm doing the radio broadcast. How are you?
Oh, good, good. Am I live on the air right now?
You're on the air.
Okay, so my brother texted you off there.
Okay.
Yeah, when should I call you back?
I'll be off. Probably it's going to take me about an hour. You can either email me.
Call back there.
What's that? You're going to call back?
Yeah, I'll give you a call back after.
I will. Okay. Thank you very much. Bye for now.
You're welcome. Bye.
Okay. So, somebody who are you there? Oops. No, I'm. Oh, you are there. Okay, that's good. And I'm online too. Okay, I'm still. So anyway, there's a lot more to this, but it's this perfect concentration of liquid minerals, electrolytes, and essential amino acids. That's where, you know, and the fact that you get good quality humic acid or fulvic acid is very important. So that's, you know, it's got to be organic and so forth. So that's why I mentioned fulvic acid, but I'm not really finding the report that I was looking for on it. It's still somewhere in here. But and I went clear down here. Let me look one more place, because I'm just one of those guys that like to find what I'm looking for. Let's try that. Yeah, I want to look at one more report here. And now that's WebMD, and they're not giving me much information. So let's go back to where we were, and we were going to talk about diabetes. So anyway, fulvic acid is one of those things, and in the morning, how I got here was taking some Intramax. I take a half a capful of Intramax, and I take about a teaspoon to a tablespoon of fulvic acid, and I hold those things in my mouth for about 3 or 4 minutes sometimes, and then I'm having then I'm drinking down some Kangen water. And then, as I'm taking a couple of capsules of that colostrum, and then I'm taking a half a teaspoon of acidophilus, and that's how I start my day. And then I go have a cup of coffee, and about 2 or 3 hours later, I have to have some protein, so I'll have some multiple amino acids, and then maybe I'll have one of my power breakfast cereals. I think I mentioned that before, how to make a power breakfast cereal, didn't I? Are you there? Did I lose you? Uh-oh. Hello? I think I lost her.
Oh, I'm still here now.
Oh, good. Okay. So I mentioned how I make that my breakfast cereal with the green foods and nuts and berries and everything. I mentioned that, didn't I?
Yeah.
Yes. So, and that's later in the day. So that's how I start my day, and that I think it would probably be a good idea for you to boost up your immune system and take that acidophilus and maybe get some fulvic acid, because we really need to increase your immune system. And now let's get into information about some of your health challenges and why you need so much help. Diabetes mellitus is a pancreatic disorder that is a major cause of illness and disability and death. Its two main symptoms are loss of weight and excess urine production, and the disease is also characterized by extreme hunger and thirst. And diabetes mellitus is a disorder of carbohydrate metabolism. That occurs because the body either secretes too little insulin, or it's incapable of using the insulin that it does secrete. There are two main types of the disease. In type 1 diabetes, which is also called insulin dependent or juvenile onset diabetes, the pancreas produces little insulin, little insulin possibly because a virus of the patient's own immune system attacks the insulin producing cells. And this type usually strikes in childhood and appears suddenly and is more serious of the two kinds. In type 2 diabetes, also known as non-insulin dependent or maturity onset diabetes, the pancreas may produce normal amounts of insulin, but for some reason the body cannot use it to metabolize carbohydrates. So have they diagnosed the type of diabetes that you have? Is it type 2?
No, they haven't diagnosed me. They said that I went to, I don't know if I was talking to herbalist or not, but a doctor that had did some tests and they said that I was borderline.
You was born with it, huh?
No, they said borderline.
Oh, borderline diabetes. That's the good news. So anyway, those are the two main types, and one is a viral, and the other one is they don't know why, and that's why they have no cure for it. So we detailed a great deal of information about diabetes, and it took me 4 2-hour shows to do it. Hold on just a minute. Hello.
Hello, am I speaking with Dr. Truman?
Yes, I'm helping somebody else right now. Is it possible for me to give you a call back afterwards?
Sure it is.
Great. Okay, I've got your number here. So as soon as I'm through here, which might take me a little while, will you be around?
It's kind of like 9:30 at night here where I'm at.
So it's getting pretty late. It's about
I just
9:30.
had just a real quick question. I was trying to order something offline you had sent to my email, and then I tried to add it to the cart and it wouldn't let me and said error or something. So I was just wondering, was the website down or should I do it for a different time?
Oh no, the website isn't down, and things are working okay. So maybe try to re-enter it again, and then check with them in the office tomorrow to make sure that it went through and everything is okay, and you don't have a double order or something going on. And then if it didn't go through, then you can physically tell them what it is you want them to do, and we'll get it done.
All right, well, I'll do that first thing tomorrow. You go ahead and take care of your business, and thank you.
Okay, God bless you. Thank you. Bye for now.
Bless you. Bye.
Okay, I had to quickly help somebody there. Are you okay? Oops, let's see if I'm back. Yeah, okay. Are you still here?
Yeah, I'm still here. I hardly can hear you.
Can you say you can't hear me very well?
Sound further away.
Okay, let me turn it up.
Yeah, you sound better now.
Let's see if does that help? Is that better?
Went back down.
Okay, all right. I've turned up the volume here. So we have 4 hours of free audio all about diabetes, and it's what it is. It's where I again detailed all of the information in the prescriptions for nutritional healing, 4th edition, about diabetes, and and I detailed all of that against what I did is I correlated all the information together, and so that you could have a real good idea of what is being done with diabetes. And I'm just about there. In a minute I'll be, here we go, because there's a lot, there's a lot of pages that are detailing the information about diabetes. And I already mentioned, some of the information about it. I can go into total detail with diabetes here, and so that you can really get a good idea of the detail of it. But once again, all of this information is already detailed and is available on the internet, and it's a free audio download at healthherbs.com, and that way you can listen to all of the information describing in detail about diabetes, and you can pause it, fast forward it, rewind it. So it would be kind of redundant for me to go into it in that much detail, and give you the latest information again here when I already did it, and it took me, looked like anywhere from 4 to 8 hours of free audio on our website, healthherbs.com, and just look for diabetes. And underneath there you'll see the broadcast that I did. But the main nutrients for diabetes are alpha lipoic acid, because it's as directed. It's a treatment for peripheral nerve damage in diabetic patients, and it helps control blood sugar levels. That's alpha lipoic acid, and you take it as directed on the label, and that is the number one nutrient that is listed in the research. The number two nutrient will cause weight loss. It's chromium picolinate or chromium polynicotinate, either one. And what this chromium does, it improves insulin's efficiency, which lowers blood sugar levels. So just those two, alpha lipoic acid, chromium. And the chromium, a combination of chromium and vanadyl sulfate and other vitamins and minerals that work synergistically to regulate blood sugar levels and correct deficiencies. And caution, if you have diabetes, and in your case you're borderline, but for those that do have diabetes, consult with your physician before taking any supplement containing chromium. In other words, we've got to make sure that everybody knows what's going on, because all of a sudden he's going to see that this is going to improve your insulin's efficiency. And if he's got somebody on insulin, and all of a sudden then it's going to throw off the dosage, you're not going to need as much insulin. He's going to need to know that. And so there are nutrients. Brewer's yeast, is another thing, or lots of B complex is a very good thing to know about. The next ingredient that is in this research report is garlic for diabetes, because the garlic decreases and stabilizes the blood sugar levels, and the garlic capsules enhances the immunity and improves circulation. Then there's the amino acids. L-carnitine. L-carnitine mobilizes fat. About 500 milligrams twice daily of L-carnitine. And if you want the newest and best carnitine, amino acid L-carnitine, get the acetyl L-carnitine, because the acetyl L-carnitine, here it is, that is really a heart rejuvenator. So it's L-carnitine. Acetyl L-carnitine is a better, more targeted use of the type of carnitine that helps the heart. But taking about 500 milligrams twice daily on an empty stomach, and you take it with water. You never take an amino acid with milk. You take 50 milligrams of vitamin B6 and 100 milligrams of vitamin C with it for better absorption. Then there's the amino acid L-glutamine. L-glutamine. And I take that as well. And it reduces the craving for sugars, because I love sweetness. But since I've been taking this for years and years and years, L-glutamine, that amino acid, I don't crave sugars anymore. I have this sweet tooth. So, and that's all my life, I liked sweet stuff. But now I don't have a problem with it. I can take it or leave it, and enjoy it when I get natural sugars. I love natural sugars. One of my favorite treats lately is to get the baker's chocolate. That's that pure bitter chocolate that's inexpensive at your grocery store, but it's pure chocolate. And I take and I dip that in raw honey that's been mixed with stevia and bee pollen, and that's a snack. And I eat one little square of that. Totally satisfied. That's it. And the heart, and that's good for the heart and so forth. You know, the chocolate, the honey, the raw honey is excellent. But L-carnitine and L-glutamine, those are some very top amino acids when there's diabetes to know about, because the L-glutamine is going to reduce the craving for sugars. And then there's taurine. And taurine, and you're going to take the L-glutamine 500 milligrams twice daily on an empty stomach. And the L-taurine, you're going to do the same thing, 500 milligrams twice daily. Same thing with L-carnitine. Guess what? You can take them all together. And you take them all together at the same time, and you don't take them with any milk, and you take them with an extra 50 milligrams of B6, and 100 and at least 100 milligrams of take 1,000. Vitamin C is so good for you. Take 1,000 milligrams. They come in 500 milligram capsules. I take them all the time. 500 milligrams. Take one or two of these along with your amino acids. I do. That's why that's there. And that B6. Well, that B6. Yep. There it is. I take that too. I take that extra B6 when I'm taking my amino acids, so that I'm getting plenty of B6. And you'll notice that a lot of these amino acids already have some B6 with it. So just, you know, that's where to go with this. And then you're getting all the mobilizing fat, reducing sugar cravings, and aiding in the release of insulin. That's what taurine does. Taurine. Do I have some taurine there? I should have some. Nope. Nope. It made it off my. Sometime. Whoop! There it is. I knew it. I knew I had it. Yep. Hey, I'm on it, folks. I am taking that as well. So that's why I don't have diabetes. Okay? And that aids in the release of insulin. Then the next thing in this list of information about diabetes is quercetin. And you can get quercetin from us, and what it does, you take 100 milligrams 3 times daily, and it helps protect the membranes of the lens of the eye from accumulations of polyols. 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 And as a result of high glucose levels, if you have high glucose levels, it's gonna attack the lens of the eyes, and that's why we have diabetic eye disorders. Okay, I'm taking a sip here. Have to stay wet. Good, we got that going. Now, then you can take raw adrenal glandulars that aids in building and rebuilding and nourishing, the glands. So, and that's where we really get into glandular therapy. I mean, so these are some things some people that might be helpful for some people, and that would be the raw adrenal glandular, as directed on the label, raw pancreas glandular, and the thyroid glandular. So what they're saying here is that science understands that you have to work with all the glands at the same time. Well, science didn't know that when, my goodness, about 25, 30 years ago, and even 15 years ago they didn't know that, but they determined that about 15 years ago is when they finally put it all in print, and they may have known it for about 5 years. So 20 years ago they knew it, but no one ever put it on paper before, like this. And so the raw glandulars they're using raw glandulars, adrenal, pancreas, and thyroid. When what I created was 8 formulations of herbs. And I used to have to, when I first figured out that you had to work with all the glands at the same time in order to really help the glandular system, because one gland is low, then the other one is low. And so you've got to work with everybody at the same time. Boom, it works. So it wound up being 56 herbs, 8 separate formulations, and we call it Gland Rejuvenator. And people take that, they buy that, they love it because it gets the glands going again. So that's a herbal extract that is food for the glands, and that is good to know about when there's diabetes. So then there's another mineral called vanadium. And why is vanadium so good for diabetes? Because it aids insulin's ability to move glucose into the cells. And we use the
I'm not sure. Can you give me the reference numbers with the numbers?
for vanadium?
Yeah, because I'm checking a list that I already have and making sure it's not something that I...
Yeah. Now the vanadium, we don't have it, I think, simply by itself. We would have it in a formulation that would be a diabetes, like in a diabetes herbal tea or diabetes balance. Let's take a look at these glucose balance capsules, number 8626. Let's take a look at that, because
What number?
8626, and let's take a look at that 8626, because that's going to have it all of these things that we're talking about. 8626. This is where we put them together for you, and this helps balance both type 1 and 2 diabetes. It helps regulate and balance the glucose sugar level in the blood. It also helps control cravings for sugar. It contains the number 1 ingredient, alpha lipoic acid, which is an antioxidant that is made by the body. And well, it's it's made by the body, but it's found in every cell of the body, where it helps turn glucose into energy. So in several studies, alpha lipoic acid appears to help lower blood sugar levels. Its ability to kill free radicals may help people with diabetic peripheral neuropathy who have pain and burning and itching and tingling and numbness in the arms and the legs and nerve damage. So alpha lipoic acid is one of the key ingredients in this in these glucose balance capsules. And here it is, vanadyl sulfate. It's in there. And then there's and the vanadyl sulfate is an intermediate in the extraction of vanadium from petroleum residues, a major commercial source of vanadium. Vanadyl sulfate is a component of some food supplements and drugs. Vanadyl compounds mimic the effects of insulin. Although humans seem to have no dietary requirement for vanadium, they haven't determined that. That's how it works. Then in this formulation is bilberry leaf and fruit, because bilberry is widely used for the complications of diabetes because of its ability to balance blood sugars, and it has been helpful in vascular, retinal disturbances, cataracts, myopia, and all forms of eye strain. And research done mostly in Italy has also uncovered bilberry's potential for retinal problems from blood circulation, diabetes, diabetes-caused glaucoma, and day blindness. This bilberry leaf and fruit, it has also been helpful for varicose veins. It has also shown to be an antispasmodic and sedative to control, or sedative to the central nervous system. And bilberry also improves night vision. It's what they gave the World War II pilots in England before they would send them out on flights at night when they couldn't see anymore and they needed to be able to see in the dark. They'd give them bilberry. They'd give them bilberry jam on their toast, and then they were all ordered to eat it because they knew, you know. Of course, anyway, the FDA probably took that toast away from them by now. But anyway, the bilberry, it improves night vision, strengthens the capillaries, and reduces blood clotting in the eyes. And the other benefits of bilberry leaf and fruit, because that's the trick. See, the fruit is great, but when you combine the leaf and the fruit, you're getting more of the medicine and the complete medicine of the plant. And I've always made my bilberry tincture extract and powders and so forth. I make the bilberry leaf with the bilberry fruit together, and you have a much more complete herbal constituents that balance and help each other. Bilberry, so the other benefits of bilberry leaf, the stimulation of peripheral circulation, inhibition of platelet aggregation, inhibition of platelet aggregation, possible use in the prevention of thromboses, control and defend against retinal hemorrhaging. We're talking about bilberry fruit and leaf. Control and defend against retinal hemorrhaging during long-term anticoagulant therapy. And bilberry leaf and fruit is used for brain circulation disorders and for kidney, hematuria, and bleeding gums, and macular degeneration of the eyes. And it is best to use the fruit with a small amount of leaf. And so that's just a few of the ingredients of this formulation. There's more, and each one of them is going to address what we're talking about. Mordica. Okay, Mordica. That herb reduces blood sugar. It enhances the libido. So you're going to feel like going out and go dancing or something, and your husband is going to love you more because the Mordica makes you feel lovable, and the Mordica detoxifies and fights infection, and it balances hormones, and it promotes milk flow, and it fights free radicals. It kills leukemia cells. Okay. The research, please understand, I'm not diagnosing or prescribing, and I'm not claiming that I'm doing these things. This is the research. This is what it says. It's all I'm doing is reporting research, which is the FDA does not want me to do that. So I'll say it again. Mordica kills leukemia cells. And it helps with rheumatoid arthritis and systemic lupus erythematosus. So that's Mordica. That means I'm getting a fax. That's okay. And I'm going to watch it, and if it doesn't, okay. Somebody called that fax number by accident, I think. Okay, so I'm just waiting to, so there we go, we got rid of that. People calling the wrong number, it's my fax line, but it's all looped into all of this. Okay, so now the next herb that's in this glucose balance formula that helps with diabetes is called Gymnema sylvestre. And why is Gymnema sylvestre in there? Because it's an Ayurvedic herb from India. It's an herb that's used for diabetes and as a digestive tonic. So that helps the digestion. And Gymnema sylvestre, it functions to block the absorption of sugar. Okay, it blocks the absorption of sugar in the intestinal tract, and it has been able to help regenerate or repair pancreatic beta cells. And this herb is used in weight reduction programs. It's used to help defend against tooth decay, to restore pancreatic function, for diabetes and alcoholism. Gymnema sylvestre, it has also been able to remove sugar from the pancreas and stimulate the circulatory system, and increases urine. It increases the urine secretion, and it activates the uterus. So, Gymnema sylvestre, some other uses are swollen glands, cough, and fever. Gymnema sylvestre has also been used to lower triglycerides and cholesterol. And furthermore, the Gymnema acid functions to paralyze the taste buds on the tongue, which sense sweetness, so you're not going to taste sweetness when you take Gymnema sylvestre. Then the taste receptors for sugar are occupied by Gymnema, and sweetness is not tasted. The effects are temporary, but long enough to help the individual control a sweet tooth. If you feel that's coming on, a few drops there, bam, I don't care if you have that candy bar or not, or that soda, and of course, I know you don't do that. Okay, now that's it for that one. We're almost done here. We've got a few more. Bean pod. Here is one that was really hard for me to get. Nobody had bean pod when I discovered the uses of bean pod that are effective in lowering blood sugar levels, and can be used with the concurrence of a doctor if he's a nice guy. And bean pod is used for mild cases of diabetes, and dried pods are particularly to be used in conjunction or rotation with other herbs such as bilberry, milfoil, dandelion, and juniper. These can be taken alone or mixed as a tea. The internal uses: bean pod tea has been useful for dropsy, water retention, and sciatica, and chronic rheumatism, and kidney and bladder problems, and uric accumulations, and loss of albumin in the urine during pregnancy. The external uses of bean pod, well, it's been used. Bean meal can also be applied directly to the skin for moist eczema problems and eruptions and itching of the skin, and has been able to promote the healing of ulcers and sores. Bean pod as a powder, moistened powder on the skin. I would moisten it with mineral water, wheat germ oil, and raw honey. That would be the perfect thing to use along with that bean pod if you're going to use it externally. Now, the prolonged use of the decoction of the tea, that's like a tea, a decoction, is made from the beans, is recommended for difficult cases of acne. Bean pod. And a caution with bean pod: do not take while pregnant. It's not recommended for those with kidney stones, ulcers, hypoglycemia, or man-made organs. No bean pods. Then there's blueberry leaf when there's diabetes. This is all in one capsule. Blueberry leaf helps to decrease blood sugar. It helps diarrhea, dysentery, diabetes. And blueberry leaf is a tonic and a blood purifier. Then here's a biblical herb for you. I love them. Hyssop leaf. Hyssop leaf is used for lung congestion, colds, flu, fevers, helps digestion, regulates blood pressure. Hyssop leaf. And then there's pleurisy root. It's all in this one capsule. One more thing after this. Pleurisy root has been used for colds, flu, bronchitis, pneumonia, fevers, and other respiratory ailments, and has been used for dysmenorrhea, amenorrhea, spasmodic pain, dyspepsia, dyspnea, and pain, and inflammatory rheumatism, tuberculosis, acute dysentery. We're talking about pleurisy root. Acute dysentery. Pleurisy root is also used for kidney troubles, colic, dysentery, scrofula, ulcers, and wounds. Last herb in this glucose balance formula is uva ursi. It helps urine incontinence. It helps with diabetes, Bright's disease, dysentery, piles, hemorrhoids, excessive menstruation, spleen, liver, pancreas disorders, bladder, mucus discharge, gonorrhea, syphilis. Externally, those are internal, but externally, uva ursi, the boiled tea can be used as a wash for abrasions, infections, contusions, and bruises. So, that's what's in the glucose balance capsules, and you start with 2 capsules twice daily, and you increase it after 3 days to 4 capsules twice daily. And of course, here's the disclaimer on every single page of our website, although I don't think the FDA can read because they continue to say that I'm diagnosing and prescribing when I'm only talking about the research that is on natural remedies. Here's the disclosure. Warning, disclaimer, the information presented herein by Alternative Health and Herbs Remedies is intended for educational purposes only. These statements have not been evaluated by the FDA and are not intended to diagnose, cure, treat, or prevent disease. Individual results may vary, and before using any supplements, it's always advisable to consult with your own health care provider. That's the disclaimer. And we have to do that. We have to do that. It's not a bad idea, you know. One should be cautious and so forth. But there you go. There is when we mentioned vanadyl sulfate, I just wanted to let you know that I did the work and I put it all together in one capsule. How's that work? I mean, how's that for you? Are you still with me? Are you there, my friend? I don't know if she's still here or not. She might have had to go, but the line is still on, so I think she's still here. At any rate, so we're talking about diabetes. We're going to go a little bit more here, and then we're going to call it an evening. But these are the essential things when there's diabetes. We talked about vanadium, which, you know, as vanadyl sulfate, and that's the way to take it, and that's the way the book says to take it, and that's the way we make it. And vitamin B complex, make sure you're getting lots of B complex, 50 milligrams of all of the B vitamins 3 times daily, morning, noon, and night. It's got to keep going through your body because it doesn't stay there. The B complex just goes right through you, so you got to keep taking it. And as long as your urine is yellow, you've got B complex going through your body. So the B vitamins work best when taken together. So that's why a good multiple vitamin with the B complex, like Intramax or some of our other multiple vitamin capsules, they have a lot of B complex in it. So the idea is to make sure you're getting 50 milligrams of each of the major B vitamins 3 times daily, and do not exceed 300 milligrams daily from all supplements. So anyone more than 300 milligrams of B complex daily, that's enough. Biotin, take some extra biotin, about 50 milligrams daily, because it improves the metabolism of glucose. Extra biotin, 50 milligrams daily. And extra inositol, 50 milligrams daily, because the inositol is important for circulation and for prevention of atherosclerosis. And extra B12 and folic acid, I take the drops. I haven't taken mine today. It reminded me I got to do it. And some extra D3 every day. I like it in the liquid form. But the B12 and folic acid, as prescribed by a physician or directed on the label, it's needed. The B12 and folic acid is needed to prevent diabetic neuropathy. Even injections under a doctor's supervision may be needed. And if injections are not available, then you definitely want to use the sublingual form, the drops, so that it goes right into your system, and so that you don't need injections. But if you do, well, then because some people are so bad off they need injections of B12 and folic acid. Then, last but not least, here on our essential list of nutrients for diabetes is zinc. 50 to 80 milligrams daily. Do not exceed 100 milligrams of zinc from all your supplements. Don't exceed more than 100 milligrams of zinc daily. Deficiency has been associated with diabetes. There's a deficiency of zinc. So use zinc gluconate lozenges, or a good quality zinc supplement like we have. Now we're running out of time here, so I want to mention that coenzyme Q10 and coenzyme A, those are both very important because they improve circulation and stabilize blood sugar. The A works well with coenzyme Q10 and in protecting the cells and removing toxic substances from the body. So that's why the A is good. It helps to detoxify, while the CoQ10 is improving the circulation and stabilizing blood sugar. Magnesium, about 750 milligrams daily or more. You'll know when you get enough magnesium. It'll make your bowel movements too soft. Then back off until they're not too soft. So magnesium, it's important for enzyme systems and the pH balance of the blood. Magnesium protects against coronary artery spasms in arteriosclerosis. And the magnesium increases energy levels. And low readings of magnesium are often found in people with diabetes and are associated with complications of eye disease. So magnesium, everybody should be really conscious of their need for magnesium, and best taken with calcium. So if we're talking about 750 magnesium, we're talking about 500 calcium. You'll notice when your calcium is correct, your fingernails will be nice and strong. And manganese, about 5 to 10 milligrams daily, take separately from calcium. Take the manganese, not magnesium, but take the manganese separate from calcium, because the manganese, about 5 to 10 milligrams daily, taken separately from calcium. Manganese is needed for repair of the pancreas. Also a cofactor in key enzymes of glucose metabolism. A deficiency is common in people with diabetes. Then psyllium husks in our special fiber, well, that's going to help to give you a good source of fiber. And the super green foods, that's another special high nutrient source of fiber. So those are the essential, the very important. And I haven't even gotten to the bottom of the list here, but I think we're probably running out of time. And I'm going to mark my spot and with a pencil. And we are going to talk more about diabetes next time, because it is a very long subject. Again, there is about 8 hours of information all about diabetes. All of this information, I already done it. It's already in a free audio. It's on the internet at healthherbs.com. 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 My email address is truman@healthherbs.com. And my goodness, we've been going for 1 hour and 35 minutes without a break. And so I think we're probably going to wrap it up today. The telephone number to call healthherbs.com and get free information, free health consultations over and over again. We will be there for you. Call them at 541-791-8400. 541-791-8400. Give them a call. Email them. Email me, Truman@healthherbs.com. TRUMAN @healthherbs.com. So, my friend, are you still there? Are you with me?
Yes.
You are. So,
What was the code for that last one?
what was the which one?
I called it the number, the 4-digit number for the last one.
Oh, the 4-digit number for the glucose balance capsules? Is that what you wanted?
I got that one. That's 8626.
That's correct. Which one did you want?
What was one you said after that?
Okay, let me go take a look.
The last one you were talking about.
I'm going back. Okay, I'm going back and we'll take a look. And I need to go further back. Is this it? This is what I'm looking for? Kidney bladder. Okay, that gland rejuvenator, is that the one you're talking about that we mentioned? That number 7.
Okay, that's one for thyroid too, right?
7017. That is a gland rejuvenator extract.
Okay.
Okay. So, and there's quite a few different things. There's a sugar controlled tea. There is a sweetener that you can have that's actually good for you, remineralizes your teeth, and helps to get rid of tooth decay, and it's called xylitol, number 7104. There is a sweetener, looks like sugar, is not sugar. You can't tell the difference. It doesn't bake out. If you're cooking something, it doesn't cook out of it like sugar does. So it's actually good for diabetics, and you can get all the sweetness you want from xylitol. Then there's an herb called stevia, and that is very, very sweet. That's what I mix with a little raw honey, because the raw honey's too sweet, and the stevia just takes the sharp sweetness out of it and just makes it a very mellow sweetness. So stevia you can take by yourself, take it by itself, or you can take the honey by itself, but together they make a real smooth sweetener that is great. So, did I answer your questions, my friend?
Yeah. The only other one is, where do I go on here to find out to take the thyroid test and
Wow, I'm having such a tough time discerning your
The
words.
thyroid, the test for thyroid.
Oh, the thyroid test. Ah, the thyroid test. Yes, okay. So the thyroid test, where to find that is on the left, on the website, where it says health info. Do you see that? As you go down the list on there, it says health info. When you click on health info, bingo, there it is. It says the top thing is, what are tinctures? How do I take them? Tells you all about that. Underneath that, it says basal temperature.
Okay.
Got it?
Yeah.
You are one of my best students. Okay, so are we good for this evening?
Yeah.
Yes. Okay, well, I'm going to let you go. I lift you up to the Lord in the name of Jesus Christ, for the glory and for the victory of the Father, the Son, and the Holy Spirit. In Jesus Christ's name I pray. To our Father, which art in heaven, hallowed be thy name. Thank you, dear Heavenly Father, for a healing here. Yes, we are praying for, and we receive and we accept for your glory. We receive a healing. And we thank you and we praise you, God. In Jesus Christ's name, we are washed in his blood. Amen.
Amen.
Amen. Okay, I will attempt to give you a buzz tomorrow, okay?
Okay. That'll be as far as the ordering the medicine. So, what helping me with that, or did you have a chance to prioritize things on the list?
I'm having such a tough time understanding what it is you're telling me. I'm sorry because of the echo.
The list of all the things that I need.
Oh, yes.
Do you have a chance to prioritize, like which ones were more important on the list, or which one I should get minimum first, or?
Okay. When you talk with Brittany and you
Okay.
talk with her tomorrow, then she's going to call and talk with me, and we're going to make sure that, and then I might call you and make sure that everything is the way we want it, and you're happy, and then we'll send your order on out to you. Okay?
Okay.
Okay. All right. We have a plan. God loves you.
All right. Okay.
Okay.
All right, then.
Okay. All right. I'll talk with you tomorrow then. Bye for now.
All right, shalom.
Shalom. Okay. That's it. We're going to make it a wrap. But diabetes. The research on diabetes, when you do the research, it took me hours and hours and hours. Whew. And I already did it once, but we're doing it again in a video and teaching other people how to do it as well. So that's it. We'll talk with you again tomorrow. Thank you for your support. I need your donations to help my legal fight in order to continue doing this, because I've been told to close down alternative health and herbs by the FDA. I've been told that if I don't close them down, they will close me down. So what choice do I have? So I need your support to continue to fight them. I've appealed the case, and they don't say that doesn't matter. We're still going to come and get you even while you're under appeal. We can come and get you anytime we want to, is what they just wrote back and told me. So this goes on every day for me, and I need your support, and any kind of a donation you can make. Go right to the website, healthherbs.com. It says click here to donate this way, that way, or the other way, or there's the address at 425 Jackson Street Southeast, Albany, Oregon 97321, and that's up there on the website as well. And you can set a donation of whatever size is appropriate for you. I appreciate it. I really need them. I have not gotten the support that I've needed, and that's why I've lost these cases, and I'm closing down, and I've lost everything. I've lost my house, gone bankrupt, lost this, but I'm still standing at the moment. And so, if anybody wants herbs and vitamins and nutritional supplements, good idea to get them before they're all taken away and people like me are driven off or incarcerated or whatever they're going to do to me. I never know. They just threaten, and bully. That's all that the FDA, FTC, DOJ, that's all they know. So I'm out of here.